हो गया.
स्टॉप कर दो. रिपीट है क्या? Let me stop for 10-15 minutes. I have a call to attend. Recording चालू किया. recording चालू था. प्लीज आप YouTube देखिए.
Hello, good evening, everybody. So today's topic is vitreous hemorrhage. So before we talk about vitreous hemorrhage, we should know where this vitreous is situated in the eye. Here you can see the anatomy or the sagittal section of the eye, where you will see the vitreous body, which is in the posterior segment of the eyeball. Here you can see this is a full cavity, this posterior segment, this is known as a posterior segment. Here this is a vitreous body. That means this is a vitreous gel. It is a structure which is a gel type of structure. And it is transparent. There are no cells or any blood vessels or anything. It's a very clear, transparent structure. This is known as a vitreous. And this is a one part of the media. Because when you see from the anterior to posterior, there are different medias, transparent medias. Like for example, cornea is there. Then in the anterior segment is aqueous. Then this pupil, which is clear area. Then there is a lens, which is a very clear lens. And then the vitreous. So all these medias are very important for the vision. For a good vision, the cornea has to be clear, the aqueous has to be clear, the pupillary area has to be very good. The lens has to be clear, the vitreous has to be very clear. Then only patient will have a good vision. And of course, the retina part, which is a macular area, has to be very good functioning area. Then the patient will have a good vision. Now, we are going to talk about the vitreous hemorrhage. In this area, the transparent area, if there is a hemorrhage in this area, this is known as a vitreous hemorrhage. So, in case of vitreous hemorrhage, from where it comes, that we have to see. Because this is a transparent structure, the surrounding area, that means the retinal vessels are there here all around. The inner coat of the eyeball, where the retina is there, in that there are blood vessels. So there are arteries and veins which are there. So naturally the blood is going to come from this area. Either it may come from the vein or it may come from the arterioles. And small capillaries are there, through that also leakage will be there, and there is a vitreous hemorrhage. Now this vitreous hemorrhage may be in a very diffuse form, whole vitreous area may be covered, total vitreous hemorrhage, or a part of it, wherever the situation is there, wherever there is a leakage of the blood vessel, there will be a hemorrhage. So maybe it is just in front of the retina only, or it may be a whole vitreous part is also, there is a hemorrhage. Depends upon from where it is coming and where are the leakage. Here you can see the picture, which is a picture of a fundus, where you can see the optic disc is here, you can see the blood vessels are there. So here there is a leakage, and there is a hemorrhage. So this is a type of hemorrhage known as a pre-retinal hemorrhage. And when this comes in the whole vitreous, it becomes a full vitreous hemorrhage. You will not be able to see the fundus also. So this is regarding your retinal and pre-retinal hemorrhage and the vitreous hemorrhage. So before we talk about vitreous hemorrhage, we should know what are the causes. So we have to ask first, very important is, if it is in one eye, usually there is a history of trauma. So we have to ask history of injury on the eyeball or somewhere near the head, if there is an injury, that we have to ask. And of course, in systemic cause also, we have to ask about asthma, or there is some pressure in the abdomen, like for example, severe coughing or sneezing. That part you have to always ask, and whether the person is doing Valsalva technique, that also can lead to hemorrhage in the eye. And the most common cause is diabetes, because in diabetes usually the vessels are involved, usually the veins are involved, and there is a formation of the capillaries, and the capillaries are very fragile. So sudden increase of pressure also can lead to leakage of the blood and can lead to hemorrhage. So it depends upon the diabetes, what is the duration and what are the type of diabetic changes in the eye. That will tell you about your hemorrhage in the vitreous because of diabetes. And one of the factor also known as hypertension. So we have to ask history of hypertension also. In case of hypertension, naturally blood vessels may be normal, the vessel wall may be normal, but because of the high pressure of the blood inside the wall can lead to leakage of the blood in the vitreous. See, this happens because we are seeing it, but this hemorrhage and all may be occurring in other organs also, so that we have to keep in mind. And of course, other very rare causes are there, which are bleeding disorders, where there's a hemophilia or leukemia or secondaries in the eye because of some primary primary cancer in the body. So these are the most common is diabetes and hypertension, of course, history of injury. And in case of retinal tear, because sometimes it happens that you want to see what is the cause. There is no history of diabetes, there is no history of hypertension, no history of any other systemic disease. So you have to find out whether there is any retinal tear or detachment, because this you'll be able to see only once the vitreous hemorrhage is reduced. So this we have to find out. Retinal tears and detachment also because of injury also, or maybe because of myopia. High myopia also can lead to retinal tears, usually in the periphery. Because if the retina, there is a tear, naturally behind that there is a choroid, which is made up of all choroidal vessels where there is a blood. So this can also occur. Now, this blood vessel rupture also is because of history of injury, and of course, because of diabetes and hypertension also, there's a rupture of the blood vessel can lead to bleeding. And most common nowadays is a macular degeneration, age-related macular degeneration, where there's a wet type of degeneration. Usually, the choroidal vessels are there, which are pushing the retina, and these new blood vessels are there, which are fragile and can lead to bleeding. And this also can occur usually in the macular area. There is a hemorrhage. And one more condition known as the idiopathic polypoidal choroidal vasculopathy. In this case also, usually there is a little hemorrhage. Usually it is a localized area, and the vessels are also dilated, congested. And and one more condition known as a vascular occlusion. Either in the retina, vein or artery, if there is an occlusion, naturally there is a back pressure of the blood, and because of that there is a hemorrhage. Of course, this occlusion can occur because of diabetes, hypertension, and of course hyperlipidemia. So serum cholesterol is also important. So keep in mind all these things. Once we know the cause, we can always investigate and find out. So when you want to do investigation, of course, diabetes, you are going to do blood sugar, fasting PP, and glycosylated hemoglobin for last 6 months, whether it is controlled or not. And hypertension, of course, you're going to check blood pressure. And if everything is normal, also we have to find out VTCT, bleeding time, clotting time, you can do. CBC, so you will try and see whether any other condition like leukemia or anything is there or not. And of course, fundus examination, very important. So all these investigations we can do. But before that, of course, for now, you have to find out by doing a ophthalmoscopy to see how much is the vitreous hemorrhage and which area it is situated, whether any other area like blood vessels, you have to see whether there is a changes because of hypertension or changes because of diabetes. All will tell you some clue you will have it that this may be because of hypertension or diabetes or any other cause like retinal tear. So this is very important and do ophthalmoscopy. See, sometimes it happens that the vitreous hemorrhage is so much that you will not be able to see retina or any other blood vessels also. If it's a fully hemorrhage, you will not see anything. Fundus is not seen at all. So in this case, we have to do B scan and find out whether retina detachment is there or not. Other things we will not come to know by B scan, only detachment you will come to know. And initial stage of vitreous hemorrhage, patient may complain of dark spots in front of the eye, maybe one or maybe many, and which are moving along with the movement of the eyeball, or there may be haze or shadows or floaters. So we have to keep in mind and try and see whether there is any bleeding in the periphery. So what I told you about the full vitreous hemorrhage, we have to do B scan. This is a type of a B scan which will tell us. Like for example, here you can see all this echoes are there. This white area. This is all hemorrhage. Usually it is a usually black color because it's a transparent structure. But if you see this type of picture, you have to see this is a vitreous hemorrhage. When there's a total vitreous hemorrhage, retina is not seen. So we have to do B scan and find out whether there is a retinal detachment. If there is a retinal detachment, we have to take the patient for vitrectomy because this detachment can increase and patient will lose vision, and after surgery the prognosis is not so good. And slit line examination, so anterior segment, everything you have to see whether any associated condition of the eyeball is there or not. And always remember, you have to see to it that management is very important in this case. Sudden reduced vision of the eye, patient is much worried. So here you will first check the BP. If it is not controlled, you are going to control BP by sending the patient to physician, and many other factors you will be controlling. Blood sugar also, if it is high, you have to control. And once your vitreous hemorrhage is reduced, usually it gets reduced within 3 months, usually. But if it doesn't, then B scan you have to do and find out whether there is a retinal detachment. If it is a retinal detachment, you have to take the patient for vitrectomy. And for reducing the hemorrhage in the vitreous, I think many other factors also are there, like homeopathy treatment also patient can take, do little meditation and take rest and take vitamin C, which is important. All this you can do. So once the vitreous hemorrhage is reduced and you can find out from where the hemorrhage is occurring, you can do laser. Laser is a thing which will block the blood vessel wherever there is a leakage. And vitrectomy, I told you, if there's a retinal detachment, you have to go for it. Or vitreous hemorrhage remains for a longer time, it can lead to organized blood in that area. There is a fibrous tissue formation and leading to retinal detachment. Many times we can give intravitreal anti-VEGF also, but many times it happens that even with injection also doesn't get cleared. So always along with, you can start along with this homeopathy treatment also, because it's a systemic cause which can control your vitreous hemorrhage. Because in case of intravitreal anti-VEGF also, there are chances of other complications also. Not in all the cases, but certain cases, yes, can have like infection, or the bleeding also can increase. You have to keep in mind according to each situation and each patient, you have to think and give the treatment. So this is a topic quite common, and if in your life anybody comes with this type of vitreous hemorrhage, see to it that these are all the factors you have to keep in mind and do the good treatment and take blessings from the patient. Thank you very much. Here you can see because of hypertension or diabetes or any other systemic cause, stress, because all this is a stress related diseases like hypertension, diabetes, many systemic diseases, are asthma or related with the mind. So much of a worries and stress can lead to all this. So the factors which can be controlled with homeopathy, we should go for it. Homeopathic treatment is also one of the very good treatment for many other uh, ophthalmic diseases which I have seen. Thank you so much.
Let me start the video. Unable to start the video, Arya. Okay, so namaste everyone, and I hope all of you are doing well. And I hope that you can hear me well. And Dr. Pushpa has already discussed about vitreous hemorrhage, and I want to talk to you about homeopathy and vitreous hemorrhage. Basically, the idea of homeopathy is individualization. Basically, the idea of case taking in homeopathy is trying to go at a deeper level, try to find the deepest patterns within a person by in-depth case taking, by finding the exact symptoms, by cross scanning the entire case with the chief complaint, family history, past history, basic nature, temperament, how that person reacted in the crisis. All this has to be done in as much detail as one can. And then a homeopathic remedy is chosen, tailor-made for the person. So homeopathy has good scope in vitreous hemorrhage, in retinal hemorrhage, really good. But I want to share with you some important homeopathic remedies that you have to keep in your mind for this kind of situation. So I'm going to show it from the software. Can you please allow me to for screen sharing? In homeopathy, there are certain remedies which are well known for the retinal and vitreous hemorrhage. Mainly, they are the Ophidia group. Mainly the remedies like lachesis, Crotalus horridus, Crotalus cascavella, Vipera, Elaps, and so on. Many other hemorrhagic remedies like phosphorus, carbonium sulf are remedies to be thought about. So I'm going to show you from the software some of the very important remedies that you need to look at. One of the very important remedies for vitreous hemorrhage is lachesis. You can see here in the software. The other very important remedy for right-sided vitreous with a lot of ecchymosis and floatings is carbonium sulf. Also very interesting carbon remedy. Vitreous opacities, there are many remedies here. One of them is gelsemium. We discussed about that previously in one of our talks. A very interesting but little lesser known remedy is the remedy Hemorrhage. Hemorrhage is a very important remedy where there is a lot of kind of hemorrhage, not just in the eye, not just in the vitrea, but also there is a lot of blood in the anterior chamber due to injuries to the cornea. And so the vitreous becomes so dark that the fundus cannot be illuminated. And Hemorrhage is belonging to Hemorrhage family. The main feeling in Hemorrhage is that I should be respected, that I should be appreciated, that I should be given a value, a little bit like Staphylococcus aureus. But the feeling is much deeper in Hemorrhage. The feeling is a lot of feeling of as if the ego is injured. There is no suppression in suppression of anger like Staphylococcus aureus. So Hemorrhage is another of very, very beautiful remedies. So there are many, many remedies like that. In homeopathy, the remedy is chosen based on the entire state of the person. So we have here our first homeopathic ophthalmic integrated clinic where the homeopathic doctor, along with the nutrition, along with yoga, along with the ophthalmologist, we sit together and treat many, many different cases of ophthalmological cases where we believe we can stop the progress of the disease and in many cases also reverse it. So take benefits of homeopathy. The importance of holistic approach remains. The importance of having healthier diet remains. One cannot kind of not look at it. So take benefits of homeopathy. You can write to us. We can do online consultation and also see you in person here in Mumbai. Thank you. You can see this is the email ID gaurang@gmail.com and the contact details and the website details. Thank you so much.